Madam Chair, thank you for the opportunity to speak to you. My name is Andreas Leinfellner. I am a pediatric consultant with 25 years of clinical experience and a special interest in child protection. I'm a member of the Paediatric Society of New Zealand and a fellow of the Royal Australasian College of Physicians. My biggest concern as a pediatrician is that this bill promotes gender-affirming therapy as the only safe and acceptable therapeutic approach for gender dysphoria, when it is neither of these. The imperative, first do no harm, lies at the core of our Hippocratic oath. The reality is that the pathway of gender-affirming therapy is loaded with enormous harm. I am aware that my submission is in contrast to that of my society. However, I can assure you that there are many other pediatric colleagues who share these concerns, some of whom are reluctant to speak out for fear of the backlash. I want to touch on a few points in my written submission. First, puberty blockers. You will have heard that puberty blockers are safe and fully reversible, just a stop button to give a gender-confused child time to explore their sexuality. This is incorrect. Blocking puberty is a massive disruption of the natural process of sexualization that involves the whole body. When given to healthy children, puberty blockers may cause serious harm. In the United States alone, over 2,300 reports of adverse reactions have been filed with the FDA, more than half of which are deemed serious cases. The drug information leaflets warn of mood swings, depression, and wait for this, suicidal ideation and suicide attempts. We have no long-term data as to whether the effects of puberty blockers are fully reversible, a fact that Britain's NHS recently acknowledged. In European studies, close to 100% of children on puberty-blocking drugs will proceed to take cross-sex hormones. So instead of representing a stop button to pause and explore, these drugs are in reality more like an acceleration button down a pathway of dangerous, lifelong medication and often mutilating surgery. So by using puberty-blocking agents, one is actively blocking the very process that will lead 80 to 90% of children out of their gender confusion. Cross-sex hormones have dangerous side effects as outlined in my written submission. These powerful medications are taken for life. They have early onset irreversible effects and they will permanently sterilize the child. They are given in very high doses without any reliable data on their toxicity. We know that the adult male brain is exposed to estrogen shrinks at the rate 10 times faster than aging. This is after just 6 months of exposure. What will happen to the growing brain exposed to cross-sex hormones for life? This is a medical experiment on children. An adult may agree to do such things to themselves, but to expect a young person to have the cognitive ability to consent to drugs and procedures that can render them infertile irreversibly, change their appearances forever, and put them at risk for serious medical complications is a massive breach of medical ethics. The majority of gender dysphoric children have associated mental comorbidities, anxiety, depression, self-harm, 20% are autistic in some studies. Some children have been physically or sexually abused and want to change their sex in order to be safe, like one of my patients. Parents come to my clinic doubly scared and confused that if they don't agree to gender-affirming therapy, they will be labeled transphobic and their child will commit suicide, a threat often used as emotional manipulation. And this bill would threaten to put them in jail. They are scared at the same time that if they agree, their child will go on a pathway of irreversible medical and surgical damage. But there's no evidence that gender dysphoria in a child by itself leads to suicide. And there's no study that has been published to prove that transitioning young children prevent suicide. The best long-term study we have is from Sweden. By 30 years out, the suicide rate among adults that transitioned was 19 times greater than the general population. And this cannot be explained by systemic societal discrimination in one of the most liberal LGBT-friendly countries. And as you know, Sweden's leading gender clinic, Stockholm's Astrid Lindgren Children's Hospital, has become the world's first to end routine treatment of minors under the age of 18 with puberty blockers and cross-sex hormones. So in conclusion, what is the right thing to do to help a gender-confused child? You support the child and the parents to a watch and wait approach. Kindly and lovingly contain the child's confusion while exploring the underlying reasons. You treat comorbidities with individual and family therapy and professional counseling. Prevent the child from the pathway of harmful medicalization. Trust the normal pubertal hormones to do their job, as they will lead most children out of their confusion. After all, gender dysphoria is a cry for help and not for hormones. Thank you.
Andreas, thank you very much. We're actually at the end of your time. Thank you for your contribution and for bringing a different view to your society. Thank you and have a lovely day.
Thank you for listening to me.
Not at all. Now, our next person is